Hi, everyone. Welcome to the 2020 State of the University event. We're very glad that you've joined us, and we're very glad to have Joe and his administrative team on hand, just in case there are any extra questions. The way we've set up the format is that we're going to ask President Harroz to provide some introductory remarks, after which Chair-elect Keri, Kornelson, and I will take turns asking questions that have been requested and curated from amongst those that the faculty submitted by request of the Faculty Senate exec. We've done our best to try to represent the spirit of the questions that have been asked. Some of the wording has been changed slightly where we have combined questions together. So we'll get through those. We have about 20 questions, which is more than half of the distinct questions, although there were many duplications. We're not sure that there will be any time after we get through those 20. If there is any time remaining, we will open the chat and allow suggestions. We have two other members of the Faculty Senate exec, Mary Sue Backus and Dave Hambright, that will be monitoring the chat and then helping Keri and I keep straight the questions that are coming in. So again, we don't know that we'll be able to get there, but we're prepared in case there is time left over. So without wasting any more minutes, I'm very pleased to turn it over to President Joe Harroz.
Amy, thank you so much. And thank you, Keri, both of you for putting so much effort into this. I want to say thank you to all the Faculty Senate exec. I meet with them monthly, and they are incredible advocates and colleagues, and their service is really valuable. So thank you. And thanks to all of you for joining in on a Wednesday afternoon. Grateful to have you here. Whenever the pandemic emerged, a question was asked of David Levy, Dr. David Levy, our university historian. And some of you all have heard this, but I think it bears repeating. The question asked of Dr. Levy was, have we had similar moments, similar events, events similar to the pandemic in the university's history? And if so, which ones do they most closely compare to? And his answer was surprising to me at first and now makes sense after having months of this. And it was that it wasn't really like any period in the university's history. And he went through the world wars and went through other elements of major upheaval in our country that have affected our university. And he said this would be unique and detailed that. And part of it, he also talked about that probably the closest analog was the Dust Bowl in Oklahoma's history that affected the University of Oklahoma. So it is a unique and brutal time. And I want to begin by acknowledging the impact on not just the institution, but first the individuals. Everyone who works for this university has been affected by it. And every single faculty member, every single staff member, every administrator. I've never seen, there's no one immune from having to work incredibly hard to make this work the way it is working, which is imperfect at best. But everyone is exhausted. I can't tell you how many people, when I talk about it, feels like not the first few weeks of the new academic year, but it feels like we're towards the end in terms of exhaustion. I know that. I understand it. I feel it. And I just want to acknowledge it and say thank you for working so hard. I know the lifeblood of this university, our faculty, have had to do things that we wouldn't have imagined a year ago. And so going fully online over spring break, adjusting to fully online classes over the summer, and now being where we are today is a massive lift. And it's done not just with a lot of energy, but also with a lot of anxiety that attaches to all of us. And it's an extraordinary time, from the pandemic to social injustice that our country is coming to terms with across the board. This is a beginning of an academic year like none before. And I just want to say thank you for how hard everyone is working. And I recognize that whenever there's such anxiety as there is right now, it's going to manifest itself in a lot of ways. And I hope that we each give each other some grace and and work through this, and we will get through this. And I think some perspective is useful. When we talk about the state of the university, let's talk about just a bit of perspective pre-COVID. I mentioned some of this last year in the State of the University speech, but I'll very quickly go through it because I believe the context matters. And that is that, in higher education in broad swaths from really World War II, the end of World War II until 1980, we had sort of this golden era of higher education with expanding state commitment and growing enrollments that attached across the university, and public higher education was able to flourish. Then around 1980, and really a period from 1980 until just a few years ago, we saw a pattern which was very clear and has been very clear, and it's increasingly the states across the country are decreasing their commitment to higher education, and that burden has been picked up by students who have had tuition and fee increases that well outpace inflation, well beyond CPI. And really from about 2017 until the pandemic hit this past spring, we saw something across the country as well, and that is the ability just to continue to pass on increases to students at those rapid rates began to diminish and go away. And there wasn't an ability to simply pass on the uncovered costs of higher education. And you can see it in the stress among universities across the nation. Especially hard hit are liberal arts four-year colleges. There was a prediction pre-pandemic that, before the pandemic, 1 in 10 private liberal arts institutions would be gone within 10 years. Those numbers have since been escalated as the pandemic is a great catalyst to 1 in 5 in the next 5 years. But pre-pandemic, if you look at the budgets of universities across the country, 30%, fully 30%, were operating with deficits. We're losing money each year, and many universities, including this one, also increased the amount of debt they had. They levered up, as they say, the balance sheet. And so that was the state going into COVID. And then we know demographically what the horizon looks like. Pre-pandemic, going into 2025, because of the financial crisis in 2009, we have been witnessing and seeing what is coming at us, which is, in 2025, the expectation is nationwide, there'll be 15% fewer first-time college-eligible high school graduates that are available in the broader market. Now, the specific impact in the Sun Belt will be less than the rest of the country, but it will still be felt because of the competition that will emerge. And so going into this, there was already systemic change happening in higher education. And COVID is, as I've said, a catalyst. So where were we? I indicated we were running in the red. We were losing money, and we had levered up the balance sheet. There was no mystery to this. In FY19, Norman campus, we identified $48 million in operating cuts to help move us back to a place of being financially sound. This past fiscal year, FY20, we identified another $31 million in operating cuts to make us more sound as an enterprise. Now, at the same time, we have not had a tuition or fee increase in 3 years. And that is, as everyone knows, by far and away, the largest part of our budget comes from tuition and fee. And we also stood in a position with no strategic plan, no written strategic plan for the university, and we hadn't had one for some 30 years. So where do we stand today? We obviously went online very quickly in the spring, and as we came back and were online the entire summer. We are now in the middle of our 4th week, and prior to starting this semester, this academic year, we were 2 or 3 weeks out from the beginning of school. There were a lot of calls to go fully online, and we believed that if we went fully online 2 or 3 weeks before school started, we would likely see our predictions were around 175, certainly in excess of 150 million in this year's losses that would pile up. Those numbers are proving themselves out across the country. I was just talking with our new engineering dean who came from UMass Amherst, and they went fully online just 2 or 3 weeks before the semester started. And they just announced on August 31st the need to cut, I think, 180 $85 million in losses from going fully online. They had 850 employees that were furloughed with no clear terminus for that. So 850 employees have lost their job. And obviously they aren't providing the education that they would had they been primarily online. And so the predictions that we had about what the impact would be were very real. We know how a lot of other universities reacted. Baylor has cut all of their benefit contributions for retirement plans. Lots of schools have had to make a number of permanent cuts. And where do we stand today? We have spent some money, as we should, but no full-time faculty or staff because of the pandemic outside of athletics. And I'll put athletics to one side for this conversation and we'll come back to it. But we've been in a position where we spent $12.5 million as a university to ensure that no one during the very beginning part of this pandemic that was full-time faculty or staff was furloughed. As we stand right now, we do not believe, and we are not projecting furloughs right now related to this pandemic. Now, a lot of money has been spent. Obviously, I said $12.5 million for administrative leave with pay. We had $8.5 million to refund our students in housing and food services. We had $2 million for a conference. They pile up. $6 million for additional COVID-related cleaning. And so there's And so there was a great deal of expenses that took place, but because of the efforts that have been extraordinary, and I've already spoken about every individual member has been a part of this, but I especially want to thank Dr. Dale Bradshaw, who's our Chief COVID Officer, not a position I would have envisioned a year ago, and Dr. Jill Irvine and Eric Conrad, Dr. Surratt, recruitment, Goddard, facilities and maintenance, obviously faculty, Senate, housing, so many more. Because of all of them, if you look at the number and the impact for where we stand in terms of our enrollment, our freshman class is down roughly 2.2%. Our transfer students are down roughly 3%, which is far lower than what we thought we would see from this pandemic. And across the institution with the retention efforts in place, we're at around substantially level. And that's a stunning testament to the hard work. There are so many heroes. Those that were doing recruitment and admissions, I just can't say enough for the work that they have done. And so we came into this and said, can we pull this off? Is this doable? One of the first things we heard from the Faculty Senate is, look, we can't just look for the faculty at legal accommodations. We have to go beyond that and look at flexibility. And I had this conversation just a few days ago with the Faculty Senate exec. And I went back and reviewed the numbers because I wanted to make sure they were accurate. What we found is that we sent out the request to faculty of those who responded. We were able to grant flexibility to in the first instance, to 97% of the faculty who asked for flexibility based on one of three criteria. Those criteria were they themselves, while not qualifying as being disabled, were at risk. No actual requirement that they send in medical information, just a statement of trust and good faith. Or category B, that the individual was a caretaker for someone who fit into one of those categories. And then the third category was other. All 97% were in the first instance granted flexibility. Of those 3% that weren't in the first instance, all through the work of department chairs and directors were ultimately found a way to have their class in a modified format. Now, I know there are individuals who didn't apply, who otherwise, and I've had this conversation with the Faculty Senate exec, or otherwise would like to be accommodated or have their flexibility addressed, and we're working on those. But the point is that through a lot of hard work out of the provost's office and from so many people, we were able to work together in a time of high anxiety, which I know continues, and grant flexibility for the mode of instruction while providing for our students in a way that certainly has attracted them to come back to us. And by the way, in addition to the well over 150 million impact we would have had we had a material increase in number of students, we would have also had a 4-year hangover because of the effects of those enrollments over the next 4 years. Now let's talk about health. And there's a lot to talk about. I'm addressing some of the questions that I've already seen in these comments because I think they fit together. I know we'll address them specifically, but certainly this question of the health is paramount. And I just, once I speak to Dr. Dale Bradshaw, our Chief COVID Officer, all the time. As we stand today, we know what's going on across the community. The dashboard provides a good deal of transparency. It's not perfect, but it is hopefully providing some transparency. What I would say is this, is that, and this was from a conversation as recently as this afternoon with Dr. Bradshaw, and a conversation with the provost of the Health Sciences Center, who is, as you know, also a physician. And that is, and by the way, the Health Sciences Center, the Oklahoma City campus, has been fully in person since May. And as almost everyone knows, the Health Sciences Center not only teaches our students in the health sciences, but we have the largest physician practice in the state, largest group of physicians, and they see patients in their offices. Where we stand right now is with the masking protocols that we have in place. With those masking protocols, to the knowledge of our professionals at this point, and I knock on wood and realize it could change, but at this point, there's not a single known case of transmission in one of our classrooms on any of our campuses. And so the masking is clearly working. And it's interesting because the masking, not just in our classroom, but the masking protocols in our physician offices, OU physicians' offices with the largest clinical practice in the state, we do not know of a single transmission from a patient to one of our healthcare providers because of the masking protocol for the patient and the physicians that are taking place. So one of the statements that I quoted Dr. Bradshaw on early in this pandemic was that Dr. Bradshaw had said that outside of simply not leaving your home, that one of the safest places you could be is our classrooms. So far, knocking on wood, so far that continues to be the case. And so keeping our classrooms safe is essential, and taking a belt and suspenders approach. That is having the masking protocol, also having distancing, 3 feet to 6 feet, obviously 6 feet being preferred, but all of those so far are working and are keeping our classrooms safe. Now, as it relates to housing, there is, and I already see comments coming in. I understand that I want to talk about this some more, not saying it's perfect. Obviously, there is community spread that's taking place. But what seems clear is that so far, to our knowledge, that's not happening in the classrooms. And so, obviously, dealing with housing, we know that in the classrooms things are far from perfect. I've heard, I taught for 2 hours yesterday, and I know that many faculty, and it's reflected in the questions, are having problems getting information about which students in their class are absent because of being out with COVID and being able to verify that information. A lot of great work is going on. It is far from perfect. We know right now there is work to be done in that communication. We'll cover that a bit more in the specific questions, but I'm not trying to act like everything is perfect. I know it's not. And so notification of absences for students and other delays I know are ongoing. So the state of the university, where do we stand right now? We're beginning to roll out the strategic plan. Someone asked, why talk about the strategic plan when we're trying to deal with the pandemic? And the answer is because we have to know where we're going. There'll be a town hall that's dedicated, several town halls dedicated to this strategic plan. There'll be one on Monday at 3 o'clock that we'll cover. So I'm not going to spend a whole lot of time covering the elements of the strategic plan, but I do want to say it's one of the great collective processes that I've seen. Pat Back and the hundreds and hundreds of hours they spent working on this strategic plan, all of the individuals across the campus that have participated in it resulted in us having a strategic plan for the first time. And it can be our North Star to help us chart our path forward. And from the very biggest perspective, this is an important matter for us to have, because the truth of the matter is the landscape for higher education, even before the pandemic, had changed, and it's being catalyzed. The idea of remaining still is simply not an option. We know that if we remain still and don't grow and don't advance on a strategic path, that we'll be caught from behind. We know that the groups like University of North Texas and UT Arlington and Arkansas and others all would like to take our position. And so the question becomes not can we remain still, but do we choose to get caught from behind, or do we move the institution forward? The strategic plan and the collective work that's gone into that is that plan that will help us move towards those very clear goals, those clear pillars that we have and strategies and the tactics that attach to those, and to be clear about our purpose, which is that we change lives, and to do everything to make sure we realize that. So as we look at this, as we look at the state of the university in an aggregate sense, and I'll add on the health part right now, we know there are a good number of students that have it as of right now. Again, thankfully, to our knowledge, no students on our campuses have had to be hospitalized. But we also know that we have to work with the communities on the spread component itself. But in the aggregate, where we stand right now is a time of challenge. We're rising to meet it together. I am extremely grateful to all 303 that are on this call right now. I know there are a good number of questions. Prepared to answer those, but before turning to those, I just want to say thank you to everyone, because I know how much stress and anxiety attaches to all of this. So thank you.
Thank you very much. We'll start. You gave us a nice segue from introducing and mentioning the strategic plan. We'd like to start the questions by talking about some issues that we have recognized amongst the faculty that are stifling faculty research and scholarship. There are some significant new administrative roadblocks to the success of the research enterprise at OU. Being in the middle of a global pandemic, the administration should try and remove the roadblocks as much as possible, not put new ones. This set the stage a little bit more directly. We're going to ask about the OU IT computer standardization and one computer policy. The computer standardization and one computer policies are hurting faculty morale and research and scholarship productivity. OU is not a corporation where inflexible policies should trump faculty independence on issues that affect their ability to get their jobs done. There's an exemption pathway to get around these policies, but it represents additional unneeded administrative burdens that greatly draw out purchases, assuming an exemption is granted, and probably costs OU more in staff faculty time than is saved by standardization. That's the preamble. Here's the question. Would you be willing to appoint a broadly representative faculty committee or to authorize the existing IT council to address the computer standardization and one computer policies and come up with more flexible faculty-centric policy?
Right. Yeah. So thanks for the question. It's one that I've heard with some frequency, Amy and Keri. I know that we've discussed it at faculty-centered exec meetings, and I hear it loud and clear. So let me give the short answer and then an elaboration on that. And the answer is absolutely yes. And in fact, just earlier this month, I asked Provost Irvine, who's on this call, and I asked Provost Irvine and VP David Surratt to be on this call, because there were a number of questions that had real specifics. I wanted to make sure if we needed refinement, they could provide. So I'll do my best to answer, but they can certainly provide additional color on those. So I know this is an issue. I truly appreciate faculty-centered exec being really transparent and indicating what a burden and headache this is. I've asked Provost Irvine to convene a committee of faculty, and you all can work on how that best is oriented, to work with Jill and David Horton to make sure we're handling it the right way. Let me say this, and that is, this is a growing pain we need to grow through. And I came from a college, in the College of Law, that had a very independent IT program. And as we look at how do we grow as a university, how do we provide, accumulate the necessary resources to fulfill our purpose, and do it in an environment where we can't just raise tuition on students and fees. And we know we're not going to get more money from the state in any sort of meaningful way. How do we do that? One of those is to look to our peers and our aspirational peers. And our aspirational peers, as we know through the strategic planning process, are those public AAUs. I know there are more questions about that we'll address. But as we look at those, to look at areas and ask, are we being efficient with our support resources? And as we look at the amount we spend on IT, we spend far more than our peers, and our performance is not at the level of certainly our aspirational peers. And so it requires that we reorganize how we do IT at the university, and that's painful because there are those that, because it hasn't been provided centrally in an efficient way, have had to build their own systems and processes. Now, that results in some glaring inefficiencies, and a good example is, 25 or so separate licenses for the same technology because there's no coordination among departments, which just has us spilling money that doesn't make any sense. But there are growing pains to get that and through that. And so working together is absolutely critical. As we look at where those large areas that we need to become more efficient in, to be able to put the money into those things that will drive us forward, it is to be more efficient in our use of our IT spend. We are to the tune of tens of millions too high relative to peers. And that's money we can use to hire new faculty, to give raises, to do all of the things that help us grow as an institution. But it's so fractured and so fragmented that it's going to take some time. And we're doing that right now. Now, is that an excuse for making it difficult to get a second device? The answer is no, but we had needed to start off with the baseline assessment of, we didn't even know how many devices we had out there, and the purchasing for it was in no way standardized. And so we're now 15 months into this. We have replaced approximately 38% of the 16,000 university computers, laptops, and desktops. And so we have the exemption policy. 93% of those have been granted, but I completely hear that takes time and energy to get done, and that is not as efficient as it should be. So a lot of this has been, how do you take a completely fragmented and inefficient IT system where there's not been central support at a sufficient level, that's required departments and colleges to go build their own, which comes at real cost because we can't communicate together in an efficient way, nor are the spends themselves efficient, and get to a more efficient practice. The answer is we have to get there. We need a baseline. I think we have the baseline certainly as it relates to the 16,000 university-owned laptops and desktops. And now we can work together to make it more efficient. And so the short answer to the question is absolutely. We need to work together. Jill has that committee working. We'll work with the Faculty Senate to ensure that it's representative and to ensure that the input is heard. But I think the answer is now we're actually in a good enough shape to actually know what we have and then work together for a policy that's more efficient.
Thank you.
Amy smiling at me like that was a really long answer, and I'll try and be more brief.
Okay, well, I guess that means I'm up. So the next question, also in this research and scholarly activity section here, has to do with financial services and accounting. The rollout of the new accounting system has been a disaster with regards to research grant accounting. It is frustrating that this rollout was undertaken without enough pre-launch training, particularly during a pandemic. Faculty can't get reliable financial information about their research grants, are limited in the ability to do certain operations, and face continuous delays in purchasing of research supplies and repair of research equipment. The new accounting system is negatively impacting research productivity and students' progress towards graduation. So this is a two-part question. The first part, what steps are being taken to immediately allow research grant accounting to get back to full reporting and operations? And then two, when might we expect overall university purchasing and finance rules to return to an efficient system that is responsive to faculty and staff needs?
Yeah, it's a nearly perfect system that we have. Yeah, it is. When you look at where we stood a year ago, with our finance and accounting systems. It was a mess. The finance and accounting systems across our 3 campuses were not uniform. And the functionality, when PeopleSoft was implemented years ago, for those of us that were here back when PeopleSoft was first implemented, the level of functionality that was not turned on for the Norman campus is stunning. And so it left us with a system that was simply unacceptable. Everyone that is in a department knows that because the system has been so bad historically, that there is the university general ledger accounts that we handle, and then every college, every department has its own system to track its expenses that can't be tracked through the university system through a very plain out-of-the-box workaday system, which means that the systems are in no way communicating, which doesn't allow us to achieve efficiency or scale. It was simply unacceptable. And so a year and a half ago, we began re-implementing PeopleSoft on the accounting and financial systems. It was something that had to be done to make sure that as a university we could function. Now, I have been around system conversions for a lot of years, and I've never seen one where at the end people say that was really a lot of fun and nearly perfect. Anytime there is a systems change, I don't care what enterprise you are in, it is going to be a headache and people are going to hate it. The truth of the matter is we had to change the system that we had, and we had to get it re-implemented to be able to function, let alone be efficient. And so that re-implementation took place over the course of the last year. A lot of people worked really hard. It is always frustrating, even when done under the best of circumstances. This is incredibly frustrating. It is re-implemented. We don't have, and so the financial, the general ledger, the financials, and the accounting has now been re-implemented as of July 1 and is still being, with further education being provided. The next step that will be done by January 1 is allowing the management software to be on top of that. So for the first time that I know of, I will be able to provide management reports to department chairs and directors so that the departments can understand where they actually stand versus the 2 different set of book system that was going on prior to this re-implementation. So it's painful. It was necessary. It didn't help that the last quarter was done during a pandemic. And my understanding is the workflow process for the payments and the transfers have been corrected. Those were off. You're always going to have errors in this. And we want to work, and I know they want to work hard to make this as efficient as possible for researchers. It's incredible. Even through all this necessary system conversion, our researchers have, and even during a pandemic, our researchers produced Norman campus double-digit growth in research expenditures. So it is incredibly frustrating to be growing at a time whenever you have to deal with systems that are out of date, and not fully operational. I think they need to be getting better. If they're not, please let me know. We're applying more resources to make this conversion, now that it's taken place, get implemented. But I acknowledge it's a headache, and it's can be dispiriting whenever a conversion takes place. Now, as far as the second part of the question, when do we expect the purchasing rules will return to an effect? The finance and purchasing rules have not changed, and will continue to follow the sponsor and the state and university purchasing rules. I think it's a matter of getting used to the new controls that are on in the system, which again is frustrating.
Hey, Joe, can I just quickly sort of clarify? Because I think this question was really about people who are having trouble with their grants, having trouble, accessing, spending money, doing the things that they need to do to use these grants that are coming in. I don't know if there's anything more that you could add to that in particular that's been particularly frustrating during this financial transition. That seems to be where we on the exec are hearing the most stress.
I think that is that answer is a subset of what we discussed. That being said, it's one that Faculty Senate Exec has raised I'd like to get back with a more specific set of answers and a process to make sure this is taken care of. We can't ask our researchers to, continue to produce the levels they are and grow, and at the same time deal with headaches. So I'm sorry for the headaches that have taken place. Let's get more specifics and see if we can't root out what's causing those inefficiencies in a more specific way.
Great, thank you. Regarding the strategic plan and AAU benchmarking, these two things, that aspiring to and benchmarking against the AAU institutions figures prominently in OU's lead-on strategic plan. It's clear that departments are expected to benchmark to AAU institutions. So this is also a two-part question. The first one is, what kind of benchmarking can we expect at the university level, and what will be shared with faculty?
Yeah, it's a great question, and one that shows that we're getting word out on the strategic plan. So that's a positive. So at the university, we've collected a lot of data, but we haven't made it useful, available and useful in a clear enough way. And so, what we have to do is take a look at those AAU measures, those categories that are out there, and benchmark ourselves against those. And I think, we know those, right? It's competitively funded, federal research support, membership in national academies, faculty awards, and fellowships and memberships, citations, USDA state and industrial research funding, doctoral education, number of PhDs, number of postdoc appointees, and undergraduate education. And so what needs to happen is we need to make sure that our chairs and directors and our faculty have access to what data are we collecting, what are those AAU benchmarks, how do we think we size up against those right now, make sure we're being honest and fair about the apples to apples, and then work on a plan to achieve the goals that we set, making clear that the goals are fair. And so I think it begins with those categories, and then really refining from there. But it's going to require a lot of conversation and work at the chair and director level.
Great, thank you for that. I'm sorry if I'm stepping on your words. Related directly to that, transparency is critical. So it's good to hear that you'll be working with the chairs and directors about all those benchmarks that you just mentioned. Will there be a report that goes beyond chairs and directors? Will there be any report on how OU's budgeting and budget model compares to AAU's, especially regarding research spending and SRI breakdown?
Yeah, it's a great question. And this is, again, one of those macro answers, and then I'll apply it to research specifically. And so we didn't have a university strategic plan. We do now. And we always had a budget that was no longer than 12 months for the university. We would, get to June, the legislature will have been out. Then the board, based upon what the legislature would do, would then set tuition and fee increases. And then we would send a 12-month budget up to the OU regents and state regents, and that would happen over the summertime. And then the clock would count down. We didn't have a clear definition of what are we going to spend money on and why. It's politically easier not to do that, but it's no way to advance an institution or be transparent. So what we're working on is multi-year budgeting to actually establish a pro forma that will lay on top of the strategic plan and indicate that this is the budget for the coming fiscal year. And then here's what we're projecting on spending by categories over the next, pick your number of years on how long you can do a pro forma. 3 to 5 years is generally, obviously each year it becomes more attenuated, but that budget needs to include not just what are we going to spend operating dollars on, but what are we going to spend capital dollars on? So because there are huge capital expenditures that have to take place that impact your ability during certain years to spend money. And there should be transparency where everyone knows what we're doing as it relates to budgets. Now, I know this question is specifically about research dollars, and the same is true for that. As we look at, we need to know how we compare to AAUs, those public peers that we are benchmarking ourselves. It can't just be how are they performing and how are we performing, but what are we investing? And how does that investment compare to others? So yes, that information will be developed and will be shared, and we should all know where it stands. And then, institutional budget models and how we approach it are also important to know. And there's a question of, do you follow a responsibility-centered management budget model, or do we do incremental E&G budgeting? And right now, it's about 75-25. 75% of it's incremental at OU, and about 25% through, college fees is based on credit hour production that takes place. Right now, SRI is managed by the Office of the VP for Research and Partnerships, with the SRI provided to the colleges themselves. Each college handles distribution of SRI to departments and faculty differently, but there needs to be clarity and transparency in that process, so everyone knows how, what our aspirational peers, how they're being funded. I think it's important to know what kind of models they have around budgeting, and then to be clear about where we stand and what model we're going to use. So I think it's a really good, important question. And the answer is yes, there'll be transparency in it, and a lot of work being done around it in the very near term.
Thank you. Go ahead, Keri.
Okay. So now we're going to transition to a couple of questions that have to do with personnel hiring and salary inequalities. The hiring process has become cumbersome and clogged. HR is too rigid, and hiring in general is overly regulated. For example, a recent EPSCoR grant that both OU and OSU received included money for new faculty lines. We started the process to recruit at the same time as OSU. OSU already has ads out while we can't even get through the first steps with HR. Even to hire a postdoc on a funded research project, there are many layers of review, and the advertisement has to be reviewed by an outside consulting firm, even when the advertisement is going to be placed by the PI on professional online outlets to which they have access. At the current rate, we'll be a full 2 to 3 months behind OSU. This is unacceptable. Additionally, unrealistic pay bands are preventing us from attracting top technical staff talent. So the first question is, would you be willing to give more HR control to colleges where discussions can be made more quickly on local budgets and where we can dictate salaries for faculty and staff that are competitive with our peers?
Okay, so this is a very fact-specific question. Let me tell you what I do know, and I'm not going to tell you what I don't know because that would take up the entire time period we have. So at a macro level, so big picture, with the hiring freeze we put in place for the pandemic, everything got slowed down, and that's super frustrating. We are now in a position where we know what our enrollment's going to look like, or looks like, and we can begin to pull that off and begin acting in a more regularized fashion. And so there's no question that the HR system has been cumbersome. It's getting more efficient. Part of the reimplementation of PeopleSoft was also around HR. And with those system changes, it should get more efficient. It better get more efficient. We spent real money on the system. And because we're moving from crisis mode into operating mode, those hard freezes will be handled in a way that hopefully should show a decrease in an increase in speed. Now, the specific question about the position relative to OSU, as far as I know, the ad wouldn't need to be reviewed by an outside consulting firm. We don't require this for faculty hires, and it shouldn't be required for postdoc hires either. Now, I know that's very fact specific, and we'll look into it, but from what I understand, and I am not the HR expert, that should not be required, but someone's not inventing this question because it's fun to invent. So there's a problem, and we need to make sure we're addressing the right question. But for the broader audience today, that shouldn't be allowed. Now, HR right now does not post any faculty hires. that posting's not done by HR. They post, departments post them on Interfolio during a regular hiring process for regular faculty for tenure track, renewable term. There is some HR postings sometimes when asked to for postdocs in Taleo. Now I'm way out of my depth right here because I don't do any of this posting. But I'm told those requests should be turned around in 24 to 72 hours, and the person that asked this question may have had a very different experience. So if so, we need to address that. Now, as it relates to salaries, and again, some of this can get into the weeds. I've looked into some of this, not all of this, but as it relates to salary structures and ranges, they're generally priced at a mid-career employee at the midpoint of the comparative market, salary range. Most advertisements for positions are posted in those ranges. And HR is not supposed to make any recommendations based upon department budgets, but just based upon those. And if there's a belief that we're going to need to go greater than that midpoint as a starting point or a reference point, that's a conversation that can take place with HR and be handled on the front end before it's ever posted if you're looking for a superstar and we know the midpoint's not going to get us there. So I know those are easy things to say on a call. I know there are real frustrations behind those questions, and I want to work on those. But that's the process it should go through to be handled.
Great, thank you. And maybe we'll encourage the author of that question to reach out either to the Senate or to you and kind of talk to you about what their experience was.
Yeah, and I, as someone who spent 9 years as a dean, I know how frustrating it can be. Even so I'm not. Let me be very clear. I understand this is born out of real frustration and we need to find real solutions. But I do think that the reimplementation of PeopleSoft for our HR systems, as we learn them, should make these processes considerably easier, or at least more efficient.
Cool. Okay, so there's a second question that's often a little bit of a different direction. The University of Oklahoma depends heavily on adjunct faculty. According to our information, there have been no pay rate increases for by-the-course adjuncts in more than a decade. Additionally, poor program management in some colleges has systematically reduced opportunities for adjunct faculty to teach more than one course per semester, and therefore has caused a loss of benefits coverage. Would you consider establishing a faculty-led committee to examine the plight of adjunct faculty at OU and to provide guidance for establishing, staffing, and maintaining this important tier of faculty?
Yeah, it's a really important question. And it's one that before we asked her to be interim provost, Jill Irvine was chairing a task force that was working with the Faculty Senate exec on a way to address this. How do we address adjunct faculty, renewable term instructors and lecturers? I know there's a conversation that's ongoing. We want to keep that conversation going forward. And I would say, let's get this back to the Faculty Senate exec. Let's make another turn of this and then see where we are on this question, because it's one that we need to address. It obviously, there are a number of layers to this that attach to how we approach renewable term faculty, how we handle the adjunct faculty members. And so I know that with all that's been taking place, that's been set to the side a bit. It needs to be picked back up. And I want to work with Jill and with the Faculty Senate exec to advance that conversation because it needs to be addressed.
Great, thank you. We're going to turn to some COVID-19 specific questions now. The first has to do with campus and classroom safety. At the last town hall meeting, you assured faculty members that an OU classroom was one of the safest places we could be if we needed to leave our homes during the COVID-19 pandemic. Indeed, a safe campus, COVID-19 plan, and the health of the OU family, is in quotes, have been promoted as the university's #1 priority. Online classes reduce risk of viral spread while also accommodating students who are quarantining or managing high personal risk. Faculty are teaching in-person classes in classrooms that do not always permit adequate social distancing and are given no option of changing rooms or moving to an online format. Even in situations in which students in quarantine can't participate in synchronous discussion via Zoom because a particular classroom and computer lack the required technology, faculty are being prohibited from making changes in classrooms or delivery method that would enable safe professional delivery of course materials. We also hear reports of greatly diminished attendance in face-to-face courses in which the lecture is available on Zoom. I have two questions, and then Keri will follow up with two more. The first is, why is OU not allowing instructors to freely move online if instructors and many students are ready and willing to do so?
That's only one question, Amy.
I'll let you answer that. And
Thanks. Thanks. Yeah, this is. I understand the concern behind this. We're in the fourth week of classes. It's been a huge lift to get to this point. And as an extension of the conversation we had just a few days ago with Faculty Senate Exec, part of this is how do you manage to be as adaptable as you can be while being consistent in our delivery and to fulfill promises that we've made. So I guess in the very first instance, I would say that from everything I have seen and heard and discussed, the comment about one of the safest places you can be is a classroom continues to be true. And I'm thankful of that. I'm not acting like that couldn't change, but that appears to be true. That being said, there is still a need to address concerns faculty have about being in the classroom. The flexibility that was provided before classes started, the process the provost's office went through, I talked about, addressed 97% in the first instance, and I believe has addressed the balance. Now, I know since that time, lots has evolved. There's been a lot that has evolved during that time period. And there are those that would like to change the format that we're in. Any changes we need to make sure we're doing in a clear way. And so doing a complete reboot right now is difficult to manage. And so there's an effort to grant additional flexibility if we can, but we've got to do it in a way that is that makes sense from a process standpoint. One of the things we're looking at immediately, and it's right now in real time, and everyone, most folks, certainly those that have put schedules together, know that we're already looking at what do we do for next semester? And the answer is not simply map over what we're doing for this semester, because we know circumstances have changed and continue to change. And so I've been speaking with the provost. Jill and her team are working really hard on how do we address classes for next semester? What are the criteria we use? Do we grant more flexibility than this past semester? And the goal is to provide even more flexibility than was provided this semester. Now, how you do that and how you implement it is really important. And it's beginning in a thoughtful way, thinking about students first. And so a survey, which we discussed right before this call came on, a survey in cooperation with the Faculty Senate Exec is being put together to survey our students, their interests and their needs. And then we'll do additional surveys of our faculty to figure out what is the best way to deliver classes for next semester. So there'll be a lot of conversation about it, but these are decisions that need to be made in the really near term. And we have additional questions for next semester, which is, how do we handle spring break? And do we start differently because of spring break to avoid that? So these are conversations that are happening in real time and that we're trying to handle internally. We've put a huge load on a lot of staff and faculty to try and get us in the classroom. And now it's how do we engineer this for next semester and grant as much flexibility as we can. I think it was Mary Sue Backus who said, we think professors know best what mode of instruction is going to provide the best education for our students. How do we incorporate that at scale and make sure that we're meeting student demand? I think the best tools right now are to listen, to survey, to have conversations, not be precipitous about it, but know we need to act really soon to get prepared for next semester. But I can tell you the absolute goal is, and my belief is, that we will have more flexibility hopefully materially more flexibility if we can, for our professors in the classroom going into next semester. It is not an instance, certainly, of whatever you chose you're locked into. Obviously, that wouldn't be right, and we're working on that. So that's not a perfect answer with a specific set of what we're doing, but that's the path we're heading down right now.
Thank you for that full answer. And part of that answer addresses the next question. I'm going to go ahead and read the next question because there's a little bit of detail I want to make sure gets asked, and then give you another chance in case you want to add a little bit more. Some faculty have expressed their opinion that a carefully created online experience will be pedagogically effective in their course, more so than an in-person with emergency measures. So specifically regarding that pedagogical soundness piece, it's not the only case that we want to ask the next question, but with that in mind, and also, will all instructors be allowed to freely choose their mode of delivery in spring 2021?
Yeah, it's the answer I've already given, and it's working closely with chairs and directors to help us divine the right answer to those. So yes, there's greater flexibility. Will it be simply the professor chooses? I think the answer is going to end up being some hybridized version of that, where we work through chairs and directors who work with the professors. I was absolutely thrilled that we were able to achieve the initial 97% flexibility and then 100%. I was shocked. I really didn't imagine that could be done. And it shows the flexibility of professors and the excellent work of the chairs and directors. I think we can do the same now that we have more time, and that we're going to be granting more flexibility going into next semester. So I'm optimistic we can get there. It won't be as simple as, yes, do whatever you want. It'll be more coordinated with chairs and directors and come out of the provost's office. So that's the path we're heading down, and I'm optimistic.
Okay. This next question is another one that's it's a series of questions that's very specific, but I also think there's maybe a broader question about exactly what policies there are in terms of a student who wants to return to class after having been exposed or after having COVID. So let me read you the question, but then maybe you can answer in a broader sense as well. So this says, if we understand correctly, students are not required to submit an all clear to return to the classroom based on their COVID-19 screening. However, graduate students working in a lab as part of our return to research that was happening over the summer were required to submit that notification to their supervisor or advisor, and faculty are supposed to submit that notification to their department chairs. Why are we treating regular students differently and in such a way as to potentially cause spread of the virus that could otherwise have been mitigated? If our intent is to try to contain the virus and protect faculty, staff, and students, not requiring the submission of an all clear to return seems counterproductive to those aims. And then there's a comment about that public health trumps any kind of FERPA issue. More importantly, we seem to have two conflicting policies. So any clarity that you could provide would be greatly appreciated.
Yeah, could you repeat the question? Kidding. That was very well articulated, Keri. This is one that I referenced earlier. And I think you've always got to be honest whenever things aren't working the way they should. And so let's start with a statement of that. As it relates to students coming back into the classroom, not everything has been perfect, and we're aware of that, and it's being worked on right now. We know that the flow of information has not worked well. Some of the offices were completely overwhelmed with how they handle their tasks. We've asked a lot of everybody, and sometimes they just get overwhelmed, and they got overwhelmed. It's being fixed, I'm told right now, but this is a very real problem that has emerged in the classroom, and all of us that teach have, likely seen elements of this. Let's talk about the inconsistency in policy. So one policy is directed to employees, and the other to students, and the students that live in the hybridized world that are in an administrative role or a faculty role are treated like staff and faculty in terms of reporting the all clear. Now we've seen there's an emergency operations committee that meets sometimes every day, but since February, when they first started, and it covers all 3 campuses, they began meeting at least together formally twice a week, and still do that. And they've just done phenomenal work. But we've found a lot of policy inconsistencies that we've had to correct. And in fact, there was one that Dr. Surratt found just in the last month that was going to be unfair to international students. And so we corrected that. So at a time when we're creating a lot of these policies out of whole cloth, there are mistakes that take place. And we're trying to identify those and fix those. And we're trying to also make sure that the staff and faculty we're asking to do things can actually get them done. So we're working on that workflow right now. This question of instructors being provided, what supportive communication can you get around students that are not in your class, that are in your class, that because we're not getting an all clear, and the rules are different for the students because they're not employees. The person who drafted the question, who wrote the question, talked about this right to privacy. And so some students are preferring not to have their private health information disclosed. If instructors want to get formal notice, they can go to the Dean of Students office, and Dr. Surratt's on this call, for students to privately verify their absence without having to provide formal communication from a health professional to the instructor. So this is, I think, akin to what we did with faculty on their requests to be granted flexibility without disclosing their personal health information. There are also students, many students test off campus, and there may be a delay or entirely exclude notice to Goddard, and we're working on that. Is there a way to make it mandatory that students go to Goddard versus an off-campus facility? And then some students may not be getting treatment in real time, or may have already recovered from any illness or temporary disability. So that's a broad answer. Dr. Surratt's on this. David, do you want to augment that?
No, I think you captured it well. One of the things that was probably a mistake on our end was realizing when you have a screening process that's also optional, as well as optional disclosure of any kind of information to Goddard then to our office, that makes some of the information less reliable when it comes to communication. That's one expectation I think we created for faculty that was the wrong one. We were able to send a lot of notifications out to faculty, but one of the other things that I also remind people is that when you are in a situation when there is community spread of the virus, we constantly tell my staff already in housing and operations since day one that we should assume that people that we do not know and interact with we should presume they are positive, whether it's symptomatic or asymptomatic. And then because of that, that's why you work to mitigate risk in the classroom. And so that's been our focus, to make sure that we look at mitigating risk in the residence halls, in the classroom spaces with masking and distancing. And so for us, we're still going to continue to offer, obviously, the opportunity for students who wish to have us interact with faculty and contact you, to let them know, or to let you all know that there may be some disruption in the classroom, but the expectation remains and still remains that students are communicating with faculty if there's any disruption in the classroom. So in terms of attendance, yeah, thank you.
Thanks, David.
All right, so another question is, has OU calculated the financial impact that might result from treating COVID amongst staff, people missing work, other financial impacts? So you sort of spoke earlier about the financial implications of having moved everything online and keeping people away from campus, but there's also likely to be a financial impact if a lot of people come down with COVID and miss work and so on and so forth. So the question is whether there's been a financial analysis in that direction.
A financial analysis of
the cost of continuing the way we are if there is a big outbreak and people are missing work and having to be treated, the insurance claims, so on and so forth.
Yeah, not to my knowledge, down to the projection that was done was what do we think the financial impact would be if we went fully online those 2 or 3 weeks before classes started. Everything else is focused on spending dollars to mitigate risk in the workplace, and so, and what we're seeing is the workplace rules appear to be working. We've talked about the classroom as it relates to workplaces. What we're having to be really vigilant about is making sure that people in offices are very conscious of the masking rules, and also on top of that, the distance as well. The number we looked at, as I indicated before, we looked at like about $150+ million hit to the institution with an ongoing hit. So, but no, not a specific calculation on what increased insurance costs will be because we're here. I will say that if we look at the results in the classroom, and if we look at the flexibility that's been granted for staff that can telecommute, those seem to be going, really well right now.
Okay, we're going to turn to testing and contact tracing and infection rates and the OU dashboard. Other universities are testing students, faculty, and staff by the thousands per week. OU is testing a fraction of that number. All experts agree that the only way of getting ahead of the COVID virus is to test and isolate asymptomatic carriers of the virus. Epidemiologists and many public health authorities assert that a positive COVID-19 test rate of more than 5% indicates insufficient testing. Currently, OU's dashboard indicates a positive rate of roughly 20%. On Wednesday, 2nd of September, the university conducted 194 tests, or 0.5% of the campus population, with a positivity rate of 31.4%. So here's the question. Does OU plan to increase testing? And if so, how will this be accomplished? If not, why didn't OU make acquiring that capacity a priority? And why weren't those investments made?
Yeah, really important questions. And these are ones that we began grappling with as soon as COVID hit. They're ones that we have the benefit of the OU Health Science Center and infectious disease experts and the whole range of experts, both in public health and in the specific disease states themselves. They've been helpful, all coordinated through Dr. Dale Bradshaw, who has been serving as our chief COVID officer. And these are really big questions, and they change based upon the availability of tests and the administration of those tests. So this is not a static question. It's one that we continue to think about and to address. We asked the initial question, and there have been this is an ongoing conversation, but an intense set of discussions with our Emergency Operations Center with Dale Bradshaw around what is the most effective way, given our position, to manage on our 3 campuses. And again, it's not static, it's continuing. But the question is, really, do you engage in a mitigation strategy or a containment strategy? And then the question becomes, do you do surveillance testing or not? And each of these have relatively specific definitions, but they come down to what are the most effective steps and what can you impact, given that we're one piece of this larger community puzzle? How do you handle this? To date, the answer has been the best thing for us to do is mitigation. There's a much lengthier answer to this, and I know Dr. Bradshaw has made himself available and would again, because these are really important questions where he can speak with more force and authority certainly than I. And David has been involved, and Jill and everyone in the front lines of these decisions to date. What we do right now has been focused around mitigation. Part of this has been availability of testing and where you're going to spend your dollars to address these. To be able to test students on a regular basis on our campus is about a $2.5 million per week at this current time undertaking. Now, the availability of testing and cost is dropping. It's certainly a point in time. And the question is, okay, once you have those, how do you handle them? We are doing some monitoring through wastewater detection that OU researchers on both campuses are a part of, and that's yielding additional information. We're doing volunteer testing right now. As you know, before any student could come into our, we call congregate housing, the dorms, they had to go through a test. That was about a $600,000 expense that we thought was worth it. And we did, and we believed helped us at the outset. Now, are there other tests or testing alternatives that are out there? There's some that would be great. We can't get access to them, and we're trying to get access. We think that supply pipeline opens up, and we're able, hopefully, to expand our opportunity to do more testing around that. So we know right now is that if we wear a mask and if we combine with that belt and suspenders and maintain social distance, that we're going to be safe, and that mitigates it. To the extent to which we ramp up, testing is one that is ongoing. David, do you want to add anything to this?
No, sure. I'll add, I think that the important thing is that there's been a ton of things put in place to start, like you said, on the right foot with mitigating risk when students actually enter the residence halls. The additional testing we're trying to employ has to be targeted because the reality is community spread has been here. When I talk to people, when I talk to colleagues and students, in a world where there's no federal leadership, no statewide leadership, and frankly, no consistent local leadership outside of the fact that we have a mayor that's actually willing to actually take some hard stances on a few issues when it comes to the virus, there has been widespread. So the mitigating risk we use is really focusing on the fact that we test, but we only get a point in time for the testing. So we focus testing efforts on areas where there's maybe a higher possibility of infection rate. So looking at congregate housing, like Joe said, in the dorms has been our focus. The next step is that we are considering doing some additional surveillance testing, similar to what we did at the onset of having students come in and looking at ways in which we can do some targeted approaches there. We've had voluntary testing stood up to make it more accessible in the last 2 weeks, where we've had some participation there, and also making it more accessible. Even the technology and ways we test has changed since the day one. Including just making it less invasive for testing. So I want to put that out there.
Okay, here's the next question. As reported by the OU Daily, the COVID-19 case numbers reported by OU Goddard do not include all cases. And so this also translates into the dashboard. OU Goddard is not doing proper contact tracing, and OU football players' COVID-19 case numbers are not being reported. Why is the university's COVID-19 dashboard not updated daily with all relevant data?
Okay, let me take a shot at this, and then I'm sure David can augment this as well. So the dashboard that we put up with daily information reflects all of the numbers for the individuals who test at Goddard. So that's faculty, staff, students, and also any dependents that are tested. And so those positive tests and results are provided, but many of the test results from Goddard are included in the state report for the Cleveland County, City of Norman, and surrounding zip codes. We want everyone to notify Goddard, even if they don't test at Goddard. But right now we don't have a way to compel them to issue those reports. So every number that we have is reported, and we need to, we're working with the Cleveland County Health Department, but we don't have those numbers ourselves. So we are similar. Goddard sends specimens to reference labs to complete the testing. The results are about a 1 to 2 day turnaround. And so the result time is based on the lab and its turnaround time. So that's part of what is provided out there. And so the update and timing will vary based upon the amount of data being analyzed and uploaded to Goddard. I can tell you I've had so many conversations, including one yesterday with, including one today with Dale Bradshaw. Sometimes they'll change their criteria. Sometimes they'll They just recently added in a new form of testing. I think it's the antigen testing, David, they just added in to the collection results. They also have periods where if you look at it day to day, where, especially at the state level, where over the weekend, the tests aren't all counted and then they're aggregated on a Monday or a Tuesday. So you see that lumpiness in the numbers that are coming out. So the numbers aren't perfect. One of the things we look at is sort of a 7-day rolling average to try and smooth out those day-to-day variations. David, do you want to add to that?
Yeah, so the one context around the data collection too is that most of that data has to be looked at manually because we're actually having non-community members from OU as well as community members from OU who are testing at Goddard. So they're also having to do a lot of manual review of the data before they update it to the dashboard for Goddard. And so so the Goddard test data, I focus more on that to look at trends for infection rates, less so to assume it is a representation of the OU community. I look more closely at the county data to get a reflection of what's going on in the community and what's happening kind of more broadly. But our Goddard rates, in terms of watching the infection rates, is what I pay attention to for sure, just to get a quick glimpse of that. The other piece I would say is on the contact tracing. There is capacity for contact tracing from the state health department, but just some people aren't aware that Goddard does contact tracing on behalf and at the authority of the state health department. So the state health department controls all of our contact tracing protocols as well as our case investigation protocols too. So that is happening pretty consistently as well, but it's also based upon the ability for students to respond to our outreach. We have a number of students who oftentimes we have to reach out to with multiple phone calls, emails, et cetera, from our nurses and staff. And so it does take time, but the detailed information they get from that helps them understand more about potential community spread.
Okay, thank you. At several campuses around the country, outbreaks have been associated with poor behavior by fraternities, sororities, and other student groups. What is the OU policy regarding the Greek system and other student associations? How is the policy enforced? And how are infractions dealt with?
Yeah, I'm smiling because the approach I wanted to use, Dr. Surratt kept me from using and probably saved me from myself once again. When this all started, I honestly, my question was, do we need to immediately show we're serious by, by engaging, as you saw across the country, in immediate suspensions of individual students and organizations? And Dr. Surratt said, why don't you let me, since I'm an actual professional in this space, apply some of my knowledge, and let's use education and what we know works with students first, and take those steps that involve positive messaging, surveying, and education to approach it. And what we learned over the course of the summer, going into this semester, has proven itself out. And Dr. Surratt's approach has shown itself to be the most prudent path, which was increase awareness, use influencers and the like to drive student behavior. We know it's not perfect. We've all seen some of the scenes that have taken place, but as compared to most other enterprises, I think Student Affairs is doing a really good job. And so, yes, there is no question the students' rights and responsibilities code section of the student code can be used if students are not in compliance or organizations are not in compliance. And we have to be ready if there is non-compliance to take those actions. The first steps that Dr. Surratt's organization has been doing have been really effective. And I can tell you, it requires, corrective behavior at times. I was in at the OU football game, and I looked down to the student section and I was like, uh-oh, looks like an educational moment. And people from Student Affairs went up there and had an educational moment, and masks went on and distances were put in place. And so it requires vigilance. It requires trusting our students. It requires giving them responsibility. And yes, in the end, having the ability to take action under the student code, up to and including suspension if it's not listened to and complied with. But those are the steps that are being taken. It is an ongoing We all can recall our 18-year-old selves. I don't think that listening to authority in the first instance was always what I was best at. But I do think that the approach that's being used is the most effective. It's not perfect, and we have to be able to have those solutions available if all other steps aren't being effective. David, do you want to add to that?
Yeah, I'll just share, what Joe was mentioning was us having a conversation around basic student development theory and understanding human behavior. So you've got a population of students who already at the age group that is engaging in risky behavior already. So what we were working on was how do we actually influence their behavior in different ways. Definitely not perfect, but when I've met with students, especially our Greek community members, I said, look, I'm not OSU. I'm not going to paint a COVID house for one of the Greek facilities. I'm not Syracuse and just chastise an entire population of students for the behaviors of a few. We actually looked at this from a very measured approach and actually starting to go into areas where there's specific issues. And so now we're actually at a point where it's clear education has been done for our community members. And now you actually see students themselves policing each other. We've had conduct notifications and fines put in place actually in the residence halls. And we also have referrals from different student organizations who've been involved in certain behaviors. And we actually were working with athletics just today to offer recommendations in conjunction with our Student Government Association. We'll be meeting tomorrow. One of the things I want to add context to is, for example, of behavior changes. One thing we were also hearing a lot from students was students coming back to us and saying, well, we heard that the university is going online after ad drop, and so we're going to get all of our fun in when we can, and just see what happens, right? So trying to understand even that pain point meant we led to different messaging and saying, look, that's not the plan. Here's what's happening, and here's actually what is the result and harm you're causing. Not realizing for some students the inequitable impact on communities of color has one big notice, and also the impact on other populations that are more susceptible in terms of that being at risk for health-related reasons or age. The other context I want to offer about the athletics piece that we are working on that too. But another example of behavior is that student tickets are general seating tickets. They do not have assigned seating to them. So most of the students were going back to where they were used to going in terms of the student section, which was that area congregate on the east side, instead of the northeast side of the stadium, which was virtually empty because that's where the students were supposed to go, but they didn't clearly know that. It was communicated, but not as fully as we should. So those are small things we're trying to do to work on, again, predicting student behavior and not simply just trying to go to do this and do that, because frankly, for those of you who have young children or teenagers, they don't always just do what you say, so.
Okay, sorry, I had to unmute myself here. All right, so the next question has to do with how we're using the data and metrics that we have. Are there specific metrics in the per capita infection rate for the university and Greater Norman communities that would trigger the halting of 20+ student in-person classes, the moving from the current mode of teaching to 100% online instruction, or the closure of the campus entirely, or some other phased responses that maybe weren't listed there?
All right. Yeah, thanks. And I see that Dr. Irvine has hopped on. She's like, I've listened to enough of Joe's responses, and I'm not even going to let him begin this answer. Let me take a shot at it, Dr. Irvine, and then you can save me from that. But thank you. So there is an August 25th memo letter that went out from Jill and myself that outlines the approach we're taking in response to this question. And so that is out there. I'll just cover a few of those guiding principles that are in there, and then we can certainly ask Jill to augment that. But those principles include closely observing the overall health and healthcare capacity on the Norman campus and in the community to guide the response. And then if health trends and healthcare capacity are moving in the wrong direction, then take action. Those negative trends and clearly identified indicators will prompt a reduction in in-person instruction. So it's not binary. So it wouldn't be a full on-off. It would be once these indicators are hit, then we would reduce in-person instruction, student activities, and overall number of students that are on campus. And so those are sort of generally the outline. Jill, do you want to add to that?
Sure. Yeah, I do think the important thing here is that we have in our minds, or tend to have in our minds, the experience of the spring, where it really was hitting the off switch very fully. And at that point, we didn't know what we were dealing with. But what we're doing now and how we're approaching it now is to think about watching these indicators that Joe mentioned. Then what kind of response do we need to take? And the idea is to take a measured response that is based on at least a few principles. And one is that we want to prioritize our first-year classes and our advanced classes that have a high level of experiential learning in them. So those are performance classes, lab-based classes, and so on, or classes that students need to complete in order to graduate. So those are the ones that we would hope to make sure that we're providing the education that we need to our students this year in the way that they need to have it. The idea too is also to make sure that campus stays open for our students who need to be here. These are international students who may have a challenging home learning environment. It's important that our students have access to the campus and the resources that are here. So we've tried to really think of a more nuanced approach to this that meets the needs of our students, but also, of course, responds to any trends we might see in terms of healthcare and healthcare capacity.
Thank you. We're going to shift over to masking policy now. During the recent visit by Governor Stitt to OU's food pantry, the governor was in violation of the university mask policy, which bans the use of neck gaiters. All faculty on campus have been provided extra double-layered paper face masks to provide to students wearing unapproved facial covering or no facial covering at all. So there are two questions related to this. First, why was the OU mask policy not enforced during the governor's visit?
Yeah, thanks. I was actually at that visit, and so I can speak to where it was and what I understood that took place. The visit was to the OU food pantry, which I thought it was great that he visited, and they do incredible work. So really proud of those folks, those students that were there. It was behind, if you all know where the food pantry is, it's on that, in that shopping strip right across from our housing. And so it's just west of the dorms in that, I think it's called Half Acre shopping strip. He came back in that parking lot and then went by and saw what they were doing. When this question was first raised, which it was the time, I asked what communication we had had with the governor's staff, and my understanding is that the communication from our team to the governor's team was not clear about what our standards were on our campus. So that problem may have actually fallen on us in terms of communicating it. That being said, it wasn't really on OU's campus. It was in that enterprise. I can assure you that for any other events that we have, if the governor comes here, we'll be very clear about what those are, so there won't be confusion next time.
Thank you for that clarification. What do you think his choice to wear a thin blue line gaiter communicates in the context of OU's efforts toward diversity, equity, and inclusion?
Yeah, I can't speak for the governor. I didn't. I don't know what that means.
Thank you.
So OU lists service to state and society as part of its mission. Given the dramatic footage from Saturday's game day showing crowds of students both in and around the stadium without masks, we do not seem to be serving the community well during a pandemic. It was particularly disturbing to see one of our community's leaders, Coach Riley, wearing a type of face mask that is explicitly forbidden by OU mask policy. Will there be a discussion of changing game day procedures in response to our experience last Saturday?
So I can tell you that in an ordinary year, there is a discussion after every game about what went right and what went wrong. The game day operations meeting, which I've been to a few times, is the world's, it's certainly our institution's biggest tabletop exercise. There are people from across the range, the entire range of those that interact with game day, and it's constantly evaluated. So we knew going into this game that there would be, so the short answer is yes. We knew that going into this game, there were going to be so many things that had to be evaluated and reevaluated and assessed and modified. And so every aspect of it is being managed. And David, spoke about the student piece because that was one that jumped out to me from the seat that I was in, that the students were in the wrong place and they needed to be moved over to the northeast part of the stadium. And I also noticed as I came on campus that that the masking requirement wasn't being enforced as strictly as it should be. So yes, there are a lot of takeaways about how we should handle that, including the types of masks we wear. Those matter even in very controlled environments. And I certainly didn't go on the field myself because anyone that's on that field has to have had a test within 24 hours of that. David?
No, I think you captured it. I think the one thing that we are moving towards, though, as I mentioned earlier, is that we've gotten to a point where there's been plenty of education. There's been plenty of reminders of actually how to kind of comport with this being the first game. This is a chance to give feedback, but we're now to the next point where we can hold folks accountable in a different way. We've already made it clear that we're ready to enforce certain policies, including restricting students from the games or restricting students altogether if we had to get to the point where there's not improvement in behavior.
And the same goes for fans that are present as well. If there's an education period and then there's the enforcement component because the education is not working. And so, we've talked about the reality that there has to be some enforcement that results in, people being removed.
Okay, switching gears a little bit here, we have a question it's more general, regarding the DEI course in the works. What are the plans for delivering the newly mandated or about to be newly mandated DEI course? Have relevant departments been involved in hiring or staffing for this instructional need?
Yeah, this to me is just incredibly exciting. I think this can be a real difference maker as we talk about how do we. There've been a lot of exciting changes that will help us realize our purpose, and a huge part of this is around DE&I. And certainly putting in mandatory faculty and staff training is a big piece of this. There are important elements that attach to this, but I think I know the one about which I'm most excited is this class, is this idea that all incoming students, freshmen in their first year and transfer students, and hopefully in their first semester, I'm not sure if we can pull that off, but I think we're endeavoring to do that, would have a class that includes DE&I, cultural competency, and starting off from a point of understanding themselves and others. And so we have, it emerged out of the conversations. Obviously, part of that included our conversations that David and I and Dr. Hypolite had with Bert and other student groups. In early March, or I guess in March, there was a faculty task force, 6 members, to assist in the development of the educational content and the first year course. We had a task force around that. And then I know that Dr. Irvine is available to talk about that in more detail. Who will develop the course? There's a search committee right now that's being formed. Jill, can we indicate who's chairing the search committee? Great. So I wasn't sure if he had agreed to do it or not, but it looks like immediate past chair of the Faculty Senate, Joshua Nelson. He's taken a long enough break from service, so he will be chairing the search committee for the faculty director of this class that will be a gateway class to OU. And so The director will be, regular faculty member and with a scholarly and academic record to lead the next stage of course development. We recognize there's a lot of faculty across the campus that have skills, and the search is open to internal and external candidates. So it'll be a full-blown search, certainly open to internal candidates as well. As far as teaching the course, we'll draw on faculty that are here, also hire additional instructional faculty and postdocs to teach the class. We also know that this class, if done well, will be a feeder into our more upper level classes that are in a lot of these areas. So we hope that it's not just a class students takes, but it also increases interest in the classes that are currently offered, that are upper division classes. It will be housed out of University College, being a gateway class, and which has years of experience in offering in this space. So obviously the academic home for our first year students if they don't otherwise have one. So that's just a general outline. Jill, do you want to add to that?
I think you covered it pretty well. Maybe a couple things to add. I mean, first of all, I do want to take this opportunity to thank the faculty task force that helped us think initially about the vision for the course and some of the starting points. And I'm grateful to them. I also, any mistakes moving forward are our own. I will not hold them responsible for the rest of the process. But a big thanks to Anthony Natali, to Heather Schotten, Mashad Fa, Mirosy Velazquez, Kalinda Eaton, and Alyssa Faison for their work on that initial phase. And as we move forward with the search process, the committee is being formed right now. So the Faculty Senate is putting forward their representatives on the committee, and suggestions are coming from the chairs and the dean for serving on the committee. So that's where we are with that. And I do want to emphasize again the point that was made about drawing from. We have lots of people, lots of departments that are engaged in this work already on campus. And they will be asked to work with the faculty director of the course on the course content and delivery. Our faculty will be asked to teach either through guest lectures or teaching sections. And then as Joe concluded, it's important, I think, to think of this as I'm actually very excited about the vision of the gateway, that this is how students enter into their general education, but also our community. But that this should be an opportunity to feed into the upper division courses that delve more deeply into these topics. So I think that's it. Thanks.
Okay, so the next pivot will be to OU Online. If an in-person experience is superior and what we consider the true college experience, why is OU advertising the benefits and quality of education students can receive in an OU Online degree program?
Yeah, thanks. So it's been fascinating going through the strategic planning process to think deeply about what it is that are the pillars of our education. What is it that we provide at its essence? And this is a teaser for next Monday's strategic plan rollout, but I'll go ahead and give you a sneak peek, which is already online, for the 5 pillars. And so those 5 pillars are becoming a top-tier public research university, preparing students for a life of success, meaning, service, and positive impact. It's making sure that OU's excellence is affordable and accessible. It's making sure that we can become a place of belonging and emotional growth for all students, faculty, and staff and alumni. And finally, enriching and positively impacting Oklahoma, the state, and the world. And so as we think about that, the degrees we provide, as we look at online, where does online fit? And online fits in a couple of spaces. It's one of the very few areas in our strategic plan that we determined was both a strategy and a tactic. And that is, it's a strategy to get more education to a broader set of students that otherwise wouldn't be able to access an OU degree. So online strategically allows us to transmit more knowledge to more students that otherwise wouldn't have access to it. It's also a tactic in that it's a way to also create additional resources for us to drive our research in those areas that don't make money. And as we've talked about OU Online, important to this question specifically, our primary focus on online is not undergraduate, it's for graduate degrees for individuals that otherwise wouldn't be able to get to school. So it's, again, focused right now on graduate students that are working and want to access the postgraduate educational opportunities. So we're not saying it is superior to an in-person undergraduate experience. We're saying that it is primarily focused on those that already have an undergraduate degree, and to the extent that we're doing degree completion, it's a different segment. It's a different segment in the undergraduate space for those that cannot come back to, or otherwise would not come back to a campus. So that's where it is. Right now we are, we had this as an emphasis prior to the pandemic. We know that the pandemic is catalyzing a lot of things. And one of the things that it's adding a great deal of energy to is that affects online is the acceptance of what is possible with online. We're also seeing a lot of universities who were losing a lot of money before the pandemic, where that pace of disruption has been increased, and they're beginning to grasp for ways to preserve themselves. And so we believe that being high quality in this space matters, and that it's going to be a real advantage for us. But we see a lot of universities that are entering the space that wouldn't have entered it before. And the Office of Digital Learning out of the Provost's office, Adam Kroom, and that operation is doing a really good job of instructional design. We know that there's thrown together online. A lot of us had to experience that. And we also know there is using instructional designers to deliver high quality online experiences. But again, that focus is on the graduate space for us right now. And the Health Science Center is now jumping into that space with us as well. And we're seeing some real opportunities that are coming out of that.
Great. Thank you. So we're getting close to the end of our time. We do have a little bit of time left. We've been collecting questions that people have inserted via the webinar system. We must have 25 questions collected already. We've been feeding those in a Google Doc to faculty, Senate exec members who have been prioritizing them for us. So we're going to turn to a couple of those. If we have time, we'll continue. Otherwise, we are opening the chat here just so that we can collect more questions. We probably won't get to the questions that are being asked in the chat from this point forward, but we do think it's important to continue collecting the questions to collect what's on people's minds so that you can know that and respond to them as we go forward. So one of the questions submitted just in the last couple of hours, Norman reported 72 new cases today. We are peaking much higher than in the summer. There are currently 614 active cases in Norman. Why are we still trying to stay in person? Why does the money come before the health discussion, and doesn't this show OU's priorities?
Yeah, appreciate the question. Obviously, as I indicated, this is a time of a great deal of stress. As we look at prioritizing health, I think it's really important that we reflect again on the fact that our masking and our mitigation policies appear by every bit of evidence to be working in our environment. And that is that masking and the distancing is working and providing a safe work environment for our faculty and a safe learning environment for our students. We can't control the larger world. We're a part of it. But the reality is, and David spoke to this with a great deal of passion. We have shown leadership. If you look at the university, we went online at a very early time this spring because we didn't know how to deal with it specifically. We also were, before any city in our state went to mandatory masking, we did. And we're monitoring very closely, do we believe that our workplace is a safe place to be? and all of our indications right now are that they are. So, you know, do we continue to monitor the numbers? Without a doubt, they're really important. Today's numbers, prior to this call, I received those. I was speaking with Dr. Bradshaw. He's doing follow-up questions because we know that a new kind of testing has been added to that. And we want to see what the impact was in terms of those 72 new cases and how we manage it. Beyond that, the August 25th memo that Dr. Irvine and I authored, I'll say in my case, signed after reviewing and providing input, we stand by it. To the extent we need to take steps to decrease the number of people here, we'll do that. And we're going to continue to act based upon, you know, discipline and approach it. Jill, do you want to add to that?
I think you covered it, Joe. Thank you. Yeah.
Okay, so the next question that's coming in to us is about teaching flexibility for spring. When will chairs and directors be given information about how to collect and submit flexibility requests for spring 21, if that's going to be the method? With enrollment starting in mid-October, there does not seem to be much time to carry this out.
Yeah, that's what's being worked on in real time. Totally agree with the question. Jill, do you want to, we've discussed this quite a bit. I know you've been working on it in more detail.
Yeah, so we are working furiously to try and get the data in that we need. So the student survey and the faculty survey are going out first thing tomorrow morning. We'll have the data back in a week, and we should be able to make some decisions shortly thereafter. It is possible that we talked about the possibility just today of pushing enrollment back just a little bit, a few days, in order to give us time to work in the most efficient manner possible. But we'll be reaching out to chairs shortly. We're on it. We know that time is short.
Great. Another question that's recently submitted. Can you speak about the ongoing hiring pause? This touches on some comments you've already made. There seems to be long delays in approving mission critical hires, even those that are grant funded. Additionally, how should units plan for staffing the spring without clear information about hiring?
Yeah, totally fair question. We had the hiring freeze in place. We're now working on how do we thaw that out so we can begin replacing positions. I feel like we are in a much better position now to know where we stand financially. Jill, do you want to speak to how we're going to approach lifting the freeze and doing it in a way that allows to break some of this up?
Sure. Well, we're waiting for some final financial data to come in at the end of September. I met with the deans today and talked about moving forward with hires. We have, sort of three groups of hires that we're dealing with, ones that were paused in the spring, ones that would normally take place this year, which we have a pot of money for from departures for faculty, and then moving forward in the spring with our normal process for hiring, this hiring cycle next year. So I think we're poised, we're ready. I've gotten some good feedback. We have a plan in place. I've gotten some good feedback from the deans today. I'll be talking to a few more people about this as we move forward, but the real point here is we do need to wait just a little bit longer to make sure that we're on solid financial footing, so we know precisely where we are in terms of what we'll release and authorize for searching.
So I'm going to ask a question that I know was kind of being discussed over in the Q&A, but I'm not sure everybody could see the question and the answer that was going on. So how do you respond to the recent story in the OU Daily, which detailed the COVID quarantine of a freshman student who was kind of left to fend for himself in a roach-infested dorm room, had to visit university food outlets, and whose care consisted of the occasional text? How is the university ensuring that each quarantine student is receiving this care or is receiving hopefully better care? If his experience is true, that means that at some level the protocols are not working.
Sure, I can take that. Yeah, and I responded to the person that posed that question in the chat too. Yes, the story that came out, obviously, as a qualitative researcher, there's multiple truths, and I think that this is truth in his case. During the first week, when we're trying to do something really, really hard for the very first time, you're testing theories and protocols, and that was the initial protocol that we had in place at that time. Since then, we no longer actually have that actual quarantine protocol in place at all. So students are able to quarantine in place to actually limit disruption like that. And we still have check-ins with our live-in professional staff who are working with students as well as our health professionals. So that's happening. And now the protocol for isolation for those individuals who are actually test positive go into that situation in the apartments, and they are actually checked in about twice daily with food deliveries that I myself have been participating in with other staff and community members and our catering crew with meal deliveries. There are check-ins via text and also check-ins with our health professional staff too. And there's some students, frankly, that want to be left alone, to be honest with you, because they are just simply trying to continue to move on with their lives too. So we do have checks in place, and it's unfortunate for that instance for that student for sure. And we are going to continue to work to improve it every day.
Great. I'm going to share a question that has just been submitted via the chat. There is broad-based concern over the potential move to a single-tiered health insurance program. If a single-tiered program is implemented, how will this added cost to the lowest paid OU employees be ameliorated?
Yeah, it's a tough question I've been grappling with. As we look at the strategic plan, there's a reality about, can we remain in the same position we're in without being caught from behind, which would have real implications if we wind up being not among the premier research universities. As this divide continues to widen, then there are real implications to the resources we're going to have to be able to, I just don't think there's a static. I think we either grow and get better and reach that mid-tier public AAU standard, or we get caught by those that would grow into these shrinking markets, as we know with 2025 coming. And so the strategic plan lays out a path to do that. Part of what we have to do around the strategic plan is figure out how do you fund this strategic plan. And the plan, as I indicated before, from 1980 until 2017 was just keep increasing tuition and fees on students. The market won't bear that, and that's contrary to our strategic plan to make sure it's affordable and accessible for our students. So how do you approach that? Part of that is you can grow your student body. That's a part of the answer to this. Part of it also is to do things like growing the pie by increasing your online graduate program offerings. But we have not increased tuition and fees for 3 years. One of the areas that continues to increase relentlessly is the cost of healthcare and benefits. It is on pace every year for a 10% plus increase every year. This year, that'd be $11 million for the university. The regents have been very clear about, looking at questions like benefits, because those are coming to them here in October, and saying, where do we stand as an outlier compared to others? When you look at one of the outlier places that we have, because it would be an $11 million increase, is that we have 6 tiers. And the question what they've instructed us very clearly is put us in line with those that are out there and find a way to mitigate the 11% increase. And so look at those that are around you. Now, I had this conversation twice with the faculty senate exec, and I have am listening to, and feel the pain that attaches to this, because by moving away from 6 tiers, that ends up creating a disproportionate burden on those that are lowest paid. And there's no question about that. So the question specifically was, how do you mitigate that? The answer is a few things. First of all, I'm proud of the fact that we spent $12.5 million to not engage in layoffs when most folks did. We spent $12.5 million to pay employees, primarily staff, for whom there was not work to do because we weren't in person. And that money avoided those predominantly in lowest paying jobs, from not having a paycheck. And so I want to make sure that we're never insensitive to unfeeling about what is the impact to individuals. So the question is, how do you mitigate going from, we're the only one that we know of that has 6 tiers. How do you move from a 6-tier system to a 1-tier system? And my recommendation, and there's still work to be done, and the board controls this ultimately, is to mitigate it by doing it over a couple of years, to, in the first year, going from 6 to 3, and in that first 3 year, in that first move to 3 tiers, to providing a large pool of money, working on how much, to decrease the negative impact to our lowest paid employees on the additional healthcare burden, health insurance burden that will attach to that. And then over the course of the 2-year transition in, look at salaries, not just benefits, and make sure those salaries are fair and competitive as well, not just the benefits. So this is the plan. It is uncomfortable. I know it has a real impact on people, and those are the steps that we're taking to try and mitigate it. The reality is that as we move and move towards the strategic plan, as we look at funding and how we fund it, we're going to have to be really honest and really clear-eyed about how we handle it and try and mitigate it wherever we can. I don't take it lightly. Nothing is finalized on it. I continue to take the concerns that I have, that others have, that Faculty Senate Exec has provided very clearly, including a recent communication, very seriously. But I want to be open and transparent, and those are the steps that we're taking to try and live within the Regent's mandate.
We will continue to push on this. We have to continue pushing on this, because even if there is a temporary fund for a year or 2 or 10, the fact remains that our lowest paid employees, some of them getting less than 10% of our higher paid, will still be paying the same amount if we have a single tier. So it doesn't matter how many years we extend out a temporary support funding. This is a very serious issue of equity that faculty have demonstrated this week we object to. It's, no matter how many years it goes out, it's an inequity if it is a single tier.
Yep, I appreciate that. Understood.
We are at 4:58. I promise not to make us go over. I appreciate that you committed to 2 hours with us. We'll give you the last 2 minutes if there's remarks you'd like to say to close us up.
You know the answer is yes, Amy. Thank you. These are really hard times. And I know that. I know everybody is, we're all nervous. We're all scared. We're all working incredibly hard. I know how hard everyone's working, and there aren't perfect decisions here. There's an effort to make the right decision and then be open if you need to change it, to changing it based upon changing circumstances. We are in a position that that we are moving forward. It is the hard work is paying off. We will keep focused on trying to provide the education we can. If circumstances get worse, we will follow the August 25th memo and adjust from there. But I just want to say how humbling it is to work with so many colleagues that care so deeply about the institution and so deeply about each other. And I want to end by saying thank you to the Faculty Senate Exec. You all are incredibly important partners. I appreciate your honesty, your friendship, and the fact that you are, continue to do an exceptional job of representing and providing a voice that needs to be heard, and hopefully one that you can see is listened to and and we, and I'm grateful. So thank you.
Thank you, and thank you to all the Faculty Senate exec members who've been here, and to everyone else. Just a final reminder that we have been collecting all of these questions. They won't be lost when we close the webinar down. Thank you.
All right, thank you very much.
Bye, David.